Good day to all our viewers. My name is Dr. Fred Ting, and I'm one of the medical oncologists here at Riverside Medical Center. Cancer, no matter how devastating the diagnosis may sound, is curable and treatable. Okay? Let me repeat that. Cancer, no matter how devastating the diagnosis may sound, is curable or at least treatable if it is diagnosed and treated early in the course of its disease. The challenging part is, its early warning signs and symptoms can be very nonspecific. This include changes in bowel or bladder habits, a sore that does not heal, unusual bleeding or discharge, thickening or lump in the breast or in other parts of the body, indigestion or difficulty in swallowing, obvious change in a wart or mole, and a nagging cough or hoarseness, among others. That's why it's very important to consult your doctor when you have these symptoms. Do not leave it to chance. It's very common for Filipinos to disregard these symptoms because we are very resilient by nature. But we have to remember that when it comes to cancer, the earlier it is identified and diagnosed, the better are the patient's outcomes and the higher the chances for cure. For the general public who do not have symptoms, please have yourselves screened. We do have screening programs for different cancer types such as breast, lung, cervical cancer, and colon cancer, which are approved and recommended by the World Health Organization and our very own Department of Health. As we now observe, patients getting diagnosed with cancers are getting younger and younger. So please discuss these different screening programs with your doctors, and if you have a family history of cancer, I encourage you to consult an oncologist. For our patients who are diagnosed with advanced cancer, please know that we have a lot of different treatment options. Sang una, panaiya nga kung may stage 4 ka nga cancer, inutil ka na, kagulaton ka na lang mapatay. No? Nowadays, we see patients with stage 4 cancers living 3 to 4 to 5 years or even longer. But it has to start with early diagnosis. Hindi na paghulaton nga maglapta, kag maglala, amo pagpakonsulta. Remember, the earlier we diagnose cancer, the earlier we can start treatment and the better our patients' outcomes. Before, patients had to go to Manila, Singapore, or the US to get their cancers treated. But now that we have our centers of excellence here at Riverside, we see patients being referred from international cancer centers in Singapore or the US or all over the country coming to Riverside to get their treatments. I always emphasize to my patients that they should let their faith be stronger than their fears, because cancer is not a death sentence and there is always hope. With the different cancer subspecialists here in Bacolod City, I can say that hope is now here at home and hope is now here at Riverside Medical Center.
For inquiries, call 0939-913-8256 or visit the Centers of Excellence at the mezzanine floor of the Riverside Medical Center's new building.